La da da da, la da da da. Hello. I am Gypsy J, and welcome back to the channel. Today we will be talking about my heart attack, and it's been 4 months since it happened, and it's been interesting to say the least. We'll start with the fact that the last video I made about my heart attack, it was just a few days after I got out of the hospital and hadn't truly grasped everything that had happened to me. Recovering from a heart attack is not as quick as you think. The more severe it is, of course, the longer it's going to take. And I don't know exactly how severe mine was, but considering I was more or less dead for 20 minutes, we're going to go with pretty freaking severe. And I am taking cardiac rehab. And let me tell you right now, anybody who has a heart attack, this is truly something you need to do. Cardiac rehab. Don't think you can do this on your own. I learned after just a few days that I didn't know what I was doing, and I probably would have gave myself another heart attack trying to rehab myself. But when this cardiac rehab was offered to me, I looked at it as a way of getting myself into the swing of things and just getting back into the gym and doing things. Well, let me tell you what, it's way more than that. And the good people at the hospital I'm going to, the cardiac rehab unit that I am in pretty much 3 days a week, Monday, Wednesday, Fridays, they have already improved me, made me healthier, made me a happier person, and they know what they're doing. And don't try and handle something that's on your own. Don't look up the internet and think I can handle my own cardiac rehab, because it just isn't going to work. It's totally different from when someone is telling you what to do. Look, I was freaking dead. My heart was beat up. It comes with all kinds of mental issues afterwards. Not real bad, I guess it depends on who you are. But you'll find yourself eventually, I've got a stent in my chest, found myself clutching my knees and kind of rocking back and forth one day and scratching at my chest and having a small meltdown. This is the truth. But, these are things you got to get through. Understanding how bad it was and, the possibility of me actually just possibly wearing a diaper or worse for the rest of my life, and to have walked away from this goes to show my good friend Marcello, his actions saved my life. What he did, he jumped into action, did the CPR, and saved my life. Now, as you can see here, he wanted me to make sure everybody knew that while he's looking chunky in this picture, after performing CPR on me and having his own personal meltdown, he lost, a few pounds. He's got some abs now. And I hope the gentleman, Mike, who also did CPR on me, I did talk to him one time, and I hope that he quit smoking. He said he was going to. He said that what he saw me go through had changed his mind about having cigarettes. So I hope he did. And the nice lady who we're not sure what her name was or who she is, but once again, if she by some chance ever sees this video, I just want to say thank you to her. All these people saved my life. And cardiac rehab, I cannot anymore say what a great thing it is. Matter of fact, here's a couple of the cardiac rehab specialists at the hospital, and they've got a little something to tell you.
Hey, I'm Megan. I am a exercise physiologist in cardiac rehab, and this is Lori. Hi.
Cardiac rehab, we're an exercise program for patients who are recovering from a heart event, whether it be a heart transplant, heart surgery, stents, heart attacks. We're a great program for patients to come in and exercise, learn their risk factors, create the habit, gain the confidence to work forever more ongoing, treating exercise like it is a medicine to help prevent future events from occurring. Okay. Cardiac rehab has been proven long-term to decrease reoccurrence of cardiac events, and it is super important. If you're interested, ask your physician for a referral to do the program.
I couldn't agree more. Cardiac rehab is extremely important. And one other thing that's really important, and it only takes a few moments of your life, is sit down at the computer and actually look up the symptoms and the signs of a heart attack, and also take a look at some of the signs before you have a heart attack. There are many signs that I missed, and I'm not going to go into them at this time, but there are aches and pains. Did your teeth hurt for no reason? Do you feel believe it or not, your teeth are jacked straight into your blood system. So anything that's going on with your heart, you can actually feel the pain in your jaw. And the same with if you have rotting teeth, it can actually poison your heart. But that's a whole nother story. But you should look up and see what some of the symptoms are before you have a heart attack, and what some of the symptoms are. They're not always common what we think they are. But cardiac rehab is extremely important. It's done me a lot of good. And if you have any kind of cardiac incident or whatever you want to call it there, you should definitely look into getting cardiac rehab. I've still got a few months to go before my body will finally, hopefully, get back to where it needs to be. But this is not an easy walk in the park. The more severe the heart attack, the longer it's going to take you to get over it. That's all there is to it. I hope you found something interesting from this video. I don't want to bore you anymore. I'm Gypsy J. Thank you for tuning in. Please come back again when I'll have some more exciting videos of someplace I'm going, been, gone, gonna do. But we're gonna do something exciting, because I always tell you, my friends, life is an adventure. It's an adventure. Go outside and have that adventure. Until next time, Gypsy J. See ya.